Namaste everyone. In this video, we are going to talk about PCE and how to prepare for PCE. So we are going to take 3 examples. First is a student physiotherapist who is in their 3rd or 4th years of physiotherapy. The second is a physiotherapist already done with their bachelor's and now they are thinking about PCE. The third one, you're already in Canada and you're done with your credentialing and you are now starting for PCE. So these are some advice and opinions from our end, and yeah, let's get started.
Alright, so for the first scenario, if you are doing your Bachelor of Physiotherapy, if you are in 3rd year or final year, so what you should do to prepare for PCE? What do you think?
So for the if you are in your final year, it's a good time to start, okay? Because you can, as such you are preparing for the exams.
What about the 3rd year?
Even if you are in your 3rd year, you need to start. But final year, I would specifically prepare in the final year. 3rd year, you're still chilling out.
For the 3rd year, you guys can focus on your basics. You are studying your basics, right? So just focus on those things
and enjoy your life as well.
Yeah.
Okay. So in your 3rd year, you can chill. But yeah, we have seen people. We just spoke with someone, and he is in his 3rd year, and they are preparing ahead of time, and that's always good. The earlier you start, the better you'll have hold on the whole subject. Right? You can start with the very basics like basic anatomy, physiology, indications, contraindications, what happens in a specific condition.
So few things are common. Always your muscle origin insertion, your trick movement, those things are very common, very basics you learned in your 1st or 2nd year. Just revise those things. If you are in 3rd year, it doesn't mean you need to study for 10 hours or 12 hours. Just like do half an hour a day, or like just do 2 hours a week or something like that. That would be enough for PC.
So in terms of what to do, we would suggest that start with your Kishner, Maggie, Sullivan. If you have Reed and Chung, use that for pulmonary, cardiopulmonary, whatever you're using. We used to use PJ Mehta, and it's a decent book. So use whatever books you're using in your school right now to make sure that your basics are very clear. So you should know what pulmonary edema would mean, what would happen to every other organ if there is a pulmonary edema, cor pulmonale. Respiratory, cardio, neuro. Just get a gist of the basic conditions.
If you're reading cardio, just go through all the waves, how the cardiac cycle works. Those are the basic things, right? So focus on that. If you are working, if you are reading something in MSK like ACL tear, so go there and check out what is the basic anatomy of anterocruciate ligament, how they torn, what are the precautions, what are the contraindication, and the treatment, obviously, because like we always focus on treatment part, we sometimes don't focus on contraindication and precaution. Those are the main and important thing here for PCE or NPT, any competitive
exam. So if you are in your 3rd or 4th year, it's good to focus on your basics. Make sure you have a detailed idea about your conditions, your osteoarthritis, rheumatoid arthritis, things like that. What happens to the bone structure, how you can prevent it, what sort of exercises you can give them, and what sort of exercises you can't give them, right? So this is a good time to start preparing yourself, preparing your mind to think logically, because most of the questions, they would want you to do some clinical reasoning with that, like why did you choose this over that. Okay, so that's something that you have to focus on if you are a student physiotherapist. Okay,
let's talk about if someone already done their BPT and they are planning to come to Canada.
So if that's the case, if you are already done with your education, what you have to do is you have to start thinking about credential evaluation. If you're thinking, that's the first thing that you start from. And then you, my friend, would have to seriously take the practical questions, the practice questions. You'll have to go through practice questions. You'll have to go through materials. So talk to people, okay? Because PC doesn't have a fixed materials. You have to check their blueprint. They have described, this is what we are looking for in musculoskeletal, like this sort of questions we would be asking you. So you'll have to go through CAPS website thoroughly, check those 50 sample questions, see if you can find any other practice questions to just train your brain. So that's a good place for you to start.
So yeah, one more thing, if you are thinking to coming to Canada, just make sure if you are done with credentialing. Let's say you are done with your BPT and you are going to come in any diploma course in next 2 months. So make sure you already done your credentialing process, because in next 2 months you are in Canada, right? Yeah. So you are going to give PCE in next 2 years. So this is the good time to start your credentialing process and get it done with it before you come to Canada, because then after that you have to request your friend or your parents to go to the university and documents and this and that. So that is another headache. So
And yeah, also plan the finances. We are soon planning to put a post on Instagram as well regarding the finances, how much it would cost you and stuff like that. So yeah, you are also going to factor in the financial aspect of it, like how much are you going to spend after the evaluation? Do you want to take the classes or not? If you want to take the classes, which classes you are going to choose? So it's a lot of things. So you'll be in the second phase of, you are not just studying, but you're also doing a lot of things around PCE as well. And
so for you guys already done BPT, you have to think most important finances, because when you'll be here, many of you already thought that you are going to do some part-time job and you will get some kind of income.
Yeah.
But if you already done your credentialing and you are going to give your PC in next, let's say 4 months, then you need some time to
off
study.
work. Yeah, you're
Right.
not going to, because if you come on student visa, you're as such doing your studies, and now you're also preparing for PC, so you won't have enough time to go for a full-time or a part-time job. So you have to factor in, you might have to take days off for your exam to prepare for your exam. So those financial plannings have to be made. We had to make it, and everyone has to make it.
So that is one thing, you have to check your finances before coming to Canada, and that's the best decision. If you don't work for first 4 months and if you clear your PC, believe me, it's your best decision in your life.
Yeah, and then comes the part of, you're already in Canada, you already have done your credential evaluation.
If you are doing any diploma courses right now,
Yeah.
and you are planning to give your PC in next 3 months.
Yeah. So, if that's the case, what we would suggest is PCE heavily focuses on musculoskeletal and neurology, and followed by cardiopulmonary and things like that. So, be very thorough with your musculoskeletal conditions, with your neuro conditions. And here in PCE, certain questions are straightforward, but certain questions would require you to have a clinical reasoning. Why you are doing this, why you won't do this, which side you will provide the cane, or how are you going to position this patient, what you are not going to do for this patient, what are the educative components that you will tell the patient's spouse. Like, a patient has stroke, what are you going to teach the spouse, so that when the patient is discharged, what would they do, things like that.
Some of the ethical questions.
Yeah, like if this is a scenario, it's usually even people who are when you interview, they'll ask you this question. So let's say someone comes to you and says, what, my insurance doesn't have any more coverage for physiotherapy, but can you use my husband's insurance to provide physiotherapy for me? So now the ethical question, this is an ethical question. You feel like, yeah, poor thing, she needs the therapy, but you can't. If you do that, it's an insurance fraud, so you can't do it. So those sort of questions would also be there, ethical questions, and even questions where you would have to prioritize patient safety first. Always make sure the patient is safe. That's your priority, be it your NPT or PC, whatever it is, patient safety is your priority. So focus on things like that.
So for you guys, make sure you connected with at least 5 other people who are going to give the exam with you next 3 months. So those people are also studying, and you can make a study group, or you can study together. Right now you can do it online, so that would help you to
prepare for the actual exam. And yeah, if you are going to sit for the exam, make sure that you have the endurance to sit for 4 hours at a stretch. Your body stays alert throughout the process. So yeah, these are a few things that I would definitely suggest you to work on. And anything you want to add? That's it from our end. If you have any other questions, leave it in the comment section below. Follow us on Instagram and Facebook. We have a group and we also have a page, so check it out. It's Movement Masters on Facebook. And see you guys next video. Take care. Bye bye.